Welcome, Dr. Ashish. And first of all, congratulations for your rank in NEET SS. Uh, we will like to start with introduction about yourself. You can tell about your college, your NEET SS rank, and when did you start your MD, and at what phase you cracked this NEET SS.
Okay. Hello everyone, I am Dr. Ashish. I hail from Maharashtra, Jalgaon. I finished my MBBS from St. J.S. Medical College and KM Hospital. Then I completed my MD from AIMS Rishikesh. I completed it last year only. Since then, I've been actively preparing for regarding NEET SS. I've been preparing since last 3 4 months. That's it.
Right, right. So, Dr. Ashish, one more thing that as you told that you have completed your residency, and after that, how was your plan? That was it more towards MD, or you were very clear that you are going to go for super specialty?
Sir, I was initially a bit confused, but throughout the journey, it got clear that I'll go for super specialization.
Okay,
But
okay,
I
and
didn't want to leave. And also, I was more attracted towards medicine. So even in super specialty, I wanted something that would be very close to medicine.
right, right. So, as I think we discussed that rheumatology is your choice, what you are going to go further.
Yes,
I
sir.
know AIMS Rishikesh part. There is a lot of inspiration there itself for rheumatology. But how was your part? That what inspired you to look after rheumatology as a specialty?
Specialty. Sir, initially, I didn't understand the material to be frank. In first year, I used to
Okay.
run away from it because it's too complicated in first year to understand.
Yeah.
But
Yeah.
then eventually, as we get along, we get posted in all the departments, super specialty departments. So I had been through all the departments, and then when I did my rheumatology posting, that is when I decided I like this subject and this is what I want to do. And moreover, I was not interested in the interventional part of medicine. I always
Okay.
wanted the analytical part more of medicine. So that is how I narrowed down to rheumatology.
Okay. So I think many of the colleges, even when we were doing MD, we didn't have rheumatology department, and I think 70 or 90% college do not have department. But the exposure really matters. That if you're exposed to this specialty, this has that adrenaline. Though we say it's a very cool branch, but making a diagnosis and all really helps. So that I think that makes a great point that being exposed. So what we feel if we are even department is not there, attending sometime conferences also gives a good insight. I got conference insight which helped me there. One more point, Dr. Ashish will like to go that at what phase of your residency you decided that you are going to prepare for NEET SS, or did you decide after the MD?
Sir, during my residency, I never had a plan to crack NEET essays. My residency was only focused on concentrating on medicine part and get to learn whatever cases I am seeing and learn medicine first. It was only after I finished my MD that is when I decided I'll pursue the NEET essay preparation. It was not before any time during the journey for 3 years.
Okay, so I think this is always a gray zone where we had discussed, and I had interview with Abash, who also got very good rank in NEET SS, and he started little early. He was more in cardio, but what you told, even Abbas had the same opinion. During residency, the goal is MD. And I
Yes.
think then exam becomes a little byproduct, and it's really good that with your preparation and plan, you have correct it well. Now, again, we'll go to in residency part only. That during your residency, what were your resources of reading? What are the textbook you read, and how did you go for that?
So, sir, initially during the residency part, I would like to break it year-wise so that would be convenient for all the
Right,
people
right.
also. So in first year, the first thing is always to survive, rather
Yeah,
than looking forward to learning
correct.
first and survive, then like match the pace of the residency. And when you're well enough with this, so what we did and what our structured program was during the residency was that during the first year, it was focused on the basic parts like ECG, electrolytes, X-ray, all the basic kind of stuff. That is what I had focused on during my first year. And during the second year, that is when I started reading Harrison quite a few times. I was sir never a page to page devoter. Ki I never I could never finish it also, and I never wanted to read Harrison from page to page. What I always did, ki whatever patients were admitted under me, I always used to look at the first and the foremost tab if you want to get information was up to date, sir,
Okay.
because like up to date. And whenever I used to come back at home or whenever I want to read about the subject, used to see Harrison. Initially, I used to read Harrison from start to end, but then, sir, I found out it's a bit haphazard way because
difficult.
like during one who doesn't know the subject, each line of Harrison is important. So you might skip through what important is written. Sir, that is when I found MedCAS also, and I found it very useful, sir. All the content and whatever you teach is already Harrison oriented. So even if I watch the videos, even if someone doesn't watch the videos and go through the notes once, or if
Yeah,
someone is not, you can watch the videos and then did Harrison, then Harrison becomes a very meaningful, whatever content is given in that. So
right.
it, matlab, sir, definitely like you guide in a way. So like we know, like we get to know okay, what points are to be stressed and what are important in that. But if we try reading Harrison from page to page, start to end, it's never like we get confused what to focus and what is to be neglected. So that is how sir I did usually. First, my
Oh,
first reference was always up to date, and then I used to read Harrison.
okay. Okay. So I think it makes perfect sense. Even uh, the focus where we also discuss is we want to supplement your Harrison reading. We really don't want to replace it. And that's,
Yes,
I
sir.
am very clear with all faculties and student also, that notes will make it easy, but it won't be the exact Harrison. So always, if you have understood the concept, go back to Harrison. It makes it very easy to read and then get your own perspective that how the medicine is going on. And I think what you told very correctly, that the base should be Harrison. After that, we can build up on that through things. And I think others also have similar opinion that if we have some guidance at our point, I will be very honest that we didn't have platforms like MedCAS or other platforms what we know. But same time, we used to ask seniors and some senior resident or the some assistant professor who were preparing for MRCP and all. So guidance do come, and even we have so many students. Irrespective of the subscription, when the guidance is needed, the faculty will guide you because at the end of the day, we are in the same community. So that is a common feeling, I think. But it's good that you stick to the main book. That is your Harrison. Now, what is your call on practical, because we know though the things are there in Harrison, but it's very difficult when it comes to Indian scenario, the Viva questions and all. So, what was your
Yes, sir.
approach for the practical where the
Sir,
student will
first
really
thing I would
value
like
it?
to highlight is for like whatever the clinical case presentation and videos that were recorded in the by Sudha ma'am, those are
Yeah.
like literally like game changers. Sir. Like even if you listen to ma'am for anything, whatever ma'am is saying, it's literally a pearl. Like it's like very depth inside that sentence. So I had finished all the videos which were there recorded by the Sudha ma'am only, and then recordings sir during the PG during our PG trainer, whatever case presentation we did, that helped it with me.
So, I
Sir,
think
but
that is
Sudha ma'am's
also,
cardiology, I
yeah.
think cardiology, sir, like all the subject taught by ma'am is very good, but cardiology especially, sir, like it was like a, like even if you listen to ma'am's two, three videos, it's like ma'am will cover all the cardiology crisp and like almost whatever is asked in exam, that ma'am would have already covered.
Right. So, we were very lucky to have her as a professor and teacher. But the same part, I think that knowledge is unparalleled, what Madam has discussed, and that is what I think is very helpful. Because in many institute you have case presentation, but sadly there are few where these things are not happening. So we encourage students that again, if cases are presented, we'll be ready to mentor that part for sure. Now, very important question that
Whatever
you,
Sudha ma'am
yeah,
tells
please
you,
tell.
like you won't find it in book. Whatever Sudha ma'ams tell you, it's like even if you go back to books, you won't find it. Whatever ma'ams is telling, then after like if you do a deep dive into that subject, you will realize what was ma'am saying is like literally true. So it's
Right.
like a gem.
Yeah, yeah, undoubtedly, and that experience matters. Whatever we say, that we can be good at subject, but seeing so many patients, being examiner for so many years, I think that has changed a lot of perspective how the ma'am is teaching to us. Now, again, going further, that if I ask that, how did you manage your, this is specifically I'm telling at the final year phase that we have duties, we have thesis building up, and that theory pressure exam, malab theory exam pressure is also building up. So, at what point you became serious about your reading in residency? Ki, this is something which is going to help me in practical and theory at least, because your journey is little different. That your NEET SS came little later. So, how was your approach, and what was the point you started really sincere about that?
Sir, it was not. It was majorly towards the second year only, sir, and the
Okay,
focus reading came only to the third year itself, sir.
okay,
So
okay,
regarding thesis, like we had like strict thesis presentation like every 6 months, so it
right,
was not like you have to rush to thesis on
okay,
the final year. So that was a good part. Yeah, I didn't have
okay.
to rush on the thesis on the third year, though I could not match it what they wanted to finish me by first second years,
That's okay,
but still
right,
like
right.
first there was a presentation. You had to present something what you did in 6 months. So like we had to do something. So that way, my thesis matlab, thesis was not a major matlab,
All
setback
right.
or a major in the third year, sir. Sir, and since second year I started reading it, sir. It was mostly regarding instead of reading system, I was most likely focused on, sir, whatever patient I'm seeing and whatever problem I'm facing. I would like to find the answers to those questions in the Harrison's and whatever subject or patient was regarding. So before and front of that, I used to read from Harrison, sir.
Right. So I think that also is very important message, and I think I keep repeating it because it was told to us by Sudha ma'am that keep learning from your patient, books, and peers. These are the three sources, but the first source is always patient. And most of the students who are really doing good, they have been patient oriented. That's what I think. What we feel that you have seen enough patient, you heard them, then your books becomes easy that it is not something you have to remember everything. It becomes a patient story which is getting converted to a chapter. So I think that's a very right approach and the right time to take. Now I'll come to MedCAS little that you have been part of group and even the part of subscription. So how did the MedCAS overall help you in preparation when you come to your first we start with MD residency total and later on the NEET part.
Sir, MedCAS was very useful. Sir, really my senior recommended me MedCAS. I was not aware of it in the first year. My seniors recommended it. And sir, typically I'm a very slow reader, so I can't finish like some 50, 100 pages throughout the day. I'm a very slow reader, so I can max finish 15, 20 pages. So while reading Harrison, it was always a challenge to me. How should I finish if I want to finish one topic? It was extensively given. So majorly, sir, MedCast always helped me in that way. Like if I saw or read the MedCast videos or read the MedCast notes, and then when I visited, I could finish all the 50 pages very quickly, and all the important points were already given in MedCast, sir. So like that way, I couldn't much important information was also not skipped. So that way, sir, MedCast was very instrumental for me, sir. And also during the practical part, sir, all the videos and also notes are there. So like I watched the videos of practical case presentation also. So those were also really helpful, sir. And regarding sir subject-wise orientation, like whenever I was posted in the super specialty department, if I was posted in cardiology, gastroenterology, during that month I tried to finish all the basics of the subject. Or definitely we can't finish the subject
Okay.
in a 1 month, but on the basic what is required that time, I used to finish it during that time, sir.
Okay, okay, great. And you have been on the group also, and I still feel, and we are, I think, very proud that the group is quite interactive. There is a daily some information which is being shared. So, does it help you help students anyway? I have positive feedbacks, but we will like to hear from you.
Yes, sir, definitely it helps, sir. Sir, and
Right.
all the information is already put. So instead of whatever we spend time on scrolling Instagram, like even if we scroll some information, it is definitely going to help in a way, sir.
Yeah. Yeah, so even that happens to us also while scrolling Instagram or Twitter for knowledge, we get somewhere else. So it's better that we are focused on a group where it is pure academics which keeps going on. Now, the few final questions that with your preparation, I think I would say it's a commendable journey, and I would say it matches to my journey a little because I was also more during MD, a confused fellow who had no idea about specialty, and that made me a good MD. That's what I feel that I focused on all subject. कि whenever we used to get posting that I will कि नहीं अब मुझे gastro लेना है, then I want to take neuro. It keeps changing, and it really helps. And after that, we prepared for the DM part. So, and then again, we both are in Romat. Now, at least we are in the same branch. So, what is your advice? I won't say use word advice, but the suggestion to your peers or your juniors that how they should plan the preparation in an appropriate way. I know there is no hurry. That was my approach, and I think you took the similar one. So that's why I'm asking that. What would you suggest your juniors who might be appearing for NEET or who are in residency?
Even my first advice would be is not to hurry up and not to take too much stress about specialty exam and everything. Just enjoy whatever you are placed in. Initially, first year, try to survive, meet some good friends because if you don't make some good friends and enjoy with them, so your 3 years journey will become hell. So even if you have very good friends, like I had very good friends, and I'm really fortunate for that. So that will make your 3 years journey very beautiful, no matter how much you're hammered in the ward. So meeting them at the night and just chilling around with them will make it very happy. Sir, and regarding this thing residency, try to focus on where you are present now currently and whatever you are exposed. So like initially, it's like a building block. It's not like I couldn't finish cardiology first chapter to last chapter. 3 year duration is a very long time. So even if you keep on focusing the cases which you are seeing daily, so eventually at the end of 3 days, you will individually read all those topics which are there as patients only teach you much of the topics. Sir, and like when you come finally, like if you ask me, rather than Harrison Load, definitely I remember, but I've always linked it to the patient. Like if there is something important, like I have to remember, I always remember any patient, like this patient had this, and that is how I relate to it, sir. And like this exam also, sir, this exam was a quite a neat exam, also was quite a bit lengthy exam, and it was a more of a clinical exam.
Yes.
And it was, sir, that time, like instead of what you have read and cramped in last few months, it won't help in the long term. Like if you have to answer in 10, 20 seconds, what first comes to your mind is a patient, whatever you have seen. So if you see patients and linked it with the studies, that is the right approach, sir, I feel, rather than just seeing patient or just reading. So just
Yeah.
first see patients and try to link whatever information is there. So that way we can remember it for very long.
Yeah. So
Sir, an
I'm
exam is not to
yeah,
it's not always like, like if you read more, you can crack more exam. Definitely reading helps. Sir, now this exam was very lengthy, sir, but like the good part is it was given in a paragraph format, like MCQ 400 big questions were there. So even if you don't know the answer, you can just answer it. Like some options were, sir, like in case some demographic details were given, and one option was it is common in female. So definitely, if the question is saying it's a 59-year female, it has to be
oh,
common in female. So
fine.
it's not like don't stress you only by reading, you can
Correct.
solve more questions. You have to be aware about to that situation. So that is also important, sir, for taking exam, because more or less everyone studies hard for that, but like you need to have some extra edges there.
Yeah. So I think from what you told, I could got 3 points and I agree with all of them. First, having good friends is most important point, not for exam, for life. Okay, because that is like it is stressful. You get rank or you do not get rank. There are certain stress which comes, and I think friends help. And Ashish, you can even tell your friend's name if you want to thank them through this, so they will also try to listen. Yeah.
Yes, sir, definitely, sir. We
Yeah.
had a group
Okay.
of friends also, sir. Sir, my roommate, sir, Dr. Sanjay Idam, he was very helpful and he was my roommate, sir. Then Dr. Rohan was there, sir. Then my medicine batchmate, sir, Dr. Sham, Dr. Rajshekar, Dr. Ujwal, Dr. Prabhat, sir. Then we had a group of seven. Then I had my friend Dr. Sanchit also, sir, Dr. Mithali, Dr. Arshi, all of them. Like we had a group of quite a few people. So with them, I never felt I was a bit stressful in all the 3 years. Like even when I felt the stress after meeting them, it was all fine.
Yeah, I think, and that part you are going to miss after residency. We all miss. So that is one. Second, what you told that basic, again, repeating that source of learning. If it's patient and then exam comes like that, and this time I think NEET SS, we found it very attractive. It was case based, and really people who were in wards got good ranks. So that was a good point. And the third point, which is most important, and I feel in exam, what you told, it's a presence of mind and common sense, which really helps. So I think that you did the best job at, and that also helps in the ranking part. So I think your suggestions are really good, and we wish you all the best. For rheumatology, I am there, and I think rheumatology is a very cohesive group where people will help you. Okay, so there is no doubt in that. Even your seniors, your mentors, you will find very good teachers in the field who are going to train you, and I think you will love the subject. So all the best, Dr. Ashish. If any more input you want to give, we are here. Or if you say, we can close it.
Okay. Okay.
Yeah, yeah, sure. Yeah, yeah, sure. Thank you, Dr. Ashish.